Researchers are hoping to expand a small but intriguing test of a new kind of way of treating deadly superbug infections. It uses a class of virus called phages, first uncovered here in Canada more than a century ago. They can attack and kill bacterial infections, but fell out of sight when antibiotics were developed.
It's called phage therapy. It's an antimicrobial treatment working where other medications do not. And Winnipeg's Cytophage Technologies is at the forefront of research and development.
This is probably one of the worst periprosthetic joint infections I'd encountered in my career. I was extremely limited in what we can do to treat her, and really, this was the end of the line.
Every year, about 130,000 Canadians get a knee or hip replacement, most without a hitch. But some end up like Taya Turcott with life-threatening bacterial infections in their new joints that defy treatment. The 79-year-old endured 15 surgeries to remove infected tissues. Antibiotics all failed or caused toxic side effects as the infection ate away at her bones and pushed out through her skin, with doctors suggesting an amputation.
The amputation would have been very high, almost up to my waist on the one side. So I would have had hardly any mobility whatsoever.
Bacteriophages are actually viruses that only infect bacteria. So they don't infect human cells, animal cells, or even plant cells. If you can think of it as landing on the moon, it would be landing on a bacterial cell. Then it will compress itself and inject its genetic information into the bacteria.
The virus then replicates inside of the bacterial cell, eventually destroying it.
So what we do is ensure that our bacteriophage that we do use is killing the patient's bacteria at a very high level, so 100% or 98%, making sure that we get rid of that bacterial infection, creating a solution for patients that don't have any solutions because of antimicrobial resistance and antibiotic resistance.
With each dose, signs of inflammation in the body, interestingly, went down. This is a very exciting moment for Canada and for Canadian medical research.
I'm just so happy to be here, to be able to be with my family, with my children, my grandchildren, and great-grandchildren. I have a lot to live for.
Cytophage Technologies is also working to fight bacterial infections that threaten animal health and food security. That includes things like targeting bacteria like E. coli and Salmonella in chickens and their eggs. Phages may even go after superbugs resistant to antibiotics one day.
Karen Pauls, CBC News, Winnipeg.
David Favreau, CTV News, Toronto.
Daniel Halmerson, CTV News, Winnipeg.